Good afternoon, everybody. Today is Wednesday, February 24th, and we have some big announcements for today. So I'm going to do the simple stuff first. Right now, as far as I'm concerned, we have no active cases in Hanna and Special Areas Number 2. You'll notice that this is a discrepancy from what the Alberta provincial government website shows. The reason I disagree with the website is that we have had the same active case on that website for greater than 2 weeks. Traditionally, this would mean that this individual is admitted to hospital. However, we do not have any COVID admissions in our hospital. So right now, I'm moving forward assuming we do not have active cases. That does not mean that we let all of our guards down. We continue to wash our hands and continue to stay home when we are sick, but it's really nice to be able to have that right now and give us some sense of peace of mind. So for today, all of a sudden now, effective this morning at 8 o'clock, anyone who was born in 1946 or earlier is eligible to book a COVID vaccination for themselves. There are 2 ways that you can do this. You can go through the phone and call 811, let them know that you would like to book a COVID vaccination, or you can go to a website. The address for that website is www.ahs.ca/COVID vaccine. A number of people here in the clinic and in the community have been trying to go on either of these methods today and have had no luck. As you can imagine, so many people want this vaccine that they're crashing very easily. So what's happening is that there are going to be multiple appointment slots available and opened as we receive vaccine. If you don't get in today, that's okay. You will be able to contact either of these sources tomorrow, the next day, next week, and be eligible to book your vaccination. For seniors residing in Hanna, our closest vaccination site is Drumheller. We are not currently offering vaccines through our pharmacies in town or through our local public health unit. There is one exception to this right now, and that is the Hanna Lodge. Residents of the lodge are going to be vaccinated in the lodge and do not have to book an appointment. That is considered to be a seniors congregate living facility, which is separate from a community dwelling senior. So for those of you who live in an apartment, who live in your own homes, you will need to use one of these 2 methods to book your vaccination. You will be given 2 appointments, one for the first shot and one for the second shot. As I say, these will be occurring in Drumheller at this time. If it looks like appointments are going to be available in Hanna, we will certainly spread the word in that situation. But for now, it's Drumheller. They're going to be doing them, I believe, 7 days a week during normal business hours. So you'll be needing to arrange rides for yourself. Now, because you are having someone bring you, unfortunately, whoever brings you, unless they also have an appointment for vaccination, will not just sort of be fit in for a shot. It will be you alone getting your vaccination. When I bring grandma, I will bring her to the door, wait for her, and bring her back, of course, okay? The other thing to note is that if your spouse was born in 1947 and you were born in 1945, your spouse is not eligible yet. They will likely be part of the next set of vaccines. When you go to the main website, if that's where you book from, there's an option for you to try to get an email reminder of when you are actually eligible, depending on your birth date. I haven't used that and can't comment necessarily on how effective it is right now, but trust that we will let you know as well, both here and then the local media, when your turn arises. I've also been asked the question, what about my other vaccines? I got my shingles vaccine, can I still get the COVID vaccine? There are some clear guidelines around this. You want to have 2 weeks before your COVID vaccine where you have not received any other vaccinations. So if you got your shingles vaccine in December, you're totally okay. You can book your COVID. If for whatever reason you're getting a pneumonia shot next week, you'll want to wait 2 weeks after your pneumonia vaccine before you book a COVID vaccine. And then you do not want to get any extra vaccinations done between your 2 COVID doses. They are traditionally done somewhere between 4 and 6 weeks apart. And as I said, they will book you for both appointments when you go online or through the phone to get your shot appointment. When you are done your COVID vaccine series, both doses, you'll want to wait 4 weeks before you book any other vaccinations. This time of year, there's very few vaccines that are given routinely. For example, we're getting to the end of our flu season. Most people, unless they book an external vaccination for tetanus or for their pneumonia, are not going to have an issue right now. Maybe next fall, that'll be a challenge for us with the flu campaign. Now, what about those people who do not have the ability to get a ride to Drumheller? I'm not sure how well this is going to work in rural, but they have told us that people should be calling 211 if they are having transportation difficulties. I'm hoping that in our community we'll be able to support one another and maybe take multiple people down at one time for a vaccine. I know that's going to hit masking rules a little hard, but we will do our best to support the community and see if we can do carpooling when necessary to get people to vaccine appointments. Like I said, if it becomes available in our community through our public health or through the local pharmacies, we will let people know. But right now, yes, you do have to travel to Drumheller for these vaccinations. I think that that's all I have. Oh, one extra thing there. Make sure that when you're going to book, you have your Alberta healthcare number. It's going to be on your Alberta healthcare card. You're going to need that information in order to register yourself. And when you show up for your appointment, they're going to need your healthcare card and a government issued ID to confirm that you are in the correct age group. Okay, I think that's all for now. I'm excited. This is a big deal for us to be able to get our vaccines, and I'll keep you in the loop. Have a great day.